The scientific program committee of this conference decided that it would be timely to bring to the participants some data on the refugee challenges in health. So the session was yesterday afternoon, and I did a general review, and two of my colleagues, Andreas Kolodzik from Heidelberg, who's the head of department of pediatrics, talked on the new diseases which dealt with sickle cell disease and thalassemia, and the Gerd Faltenhöfer from Cologne, head of department of the infectious, said what she had found on the data on the infections. So as you can see on this map, it's something that you well know now, which summarized the migrant crisis of 2015. You see that most of the countries in Europe are facing the arrival of migrants. The migrants, of course, have various country of origin and various reasons to migrate to our countries. What is definitely important, and is the major, I think, issue which we three of us have pointed out, is the numbers which have not been expected to increase so far. The illegal border crossing in the 28 EU member states is 6 times more than anticipated in 2014, and the number of asylum applications have doubled. Therefore, we all thought that the refugee health problems required our full attention. So what are the main health problems, and what are they related to? I'll summarize them rapidly here in this slide. Of course, is the conditions of migration, and in this setting, apart from the most drastic one from drowning, as you can imagine, and also sexual aggression and disappearance of children, there is all the infectious problem that they may find during their migration. It varies, of course, depending on the country of asylum, and this is essentially, and I will have a slide for that, related to the health program which is set up in each member state for asylum and seeking migrants. And of course, the country of origin of these refugees, and they bring along their own medical problems, lack or not of vaccination, or their genetic abnormalities linked to their country of origin, and sometimes the previous treatments they may have had for their health problems. So even though more than 100 organizations and 10 well-known organizations, including WHO and the European Commission, stress the right to health care for all persons and all citizens, the health approaches in member states vary widely. The screening of different diseases is done in most member states only in asylum seekers, and in a very few member states to all newly arrived migrants. Health screening identifies only communicable diseases, which is essentially an infectious disease in some member states, whereas it's sometimes only targeted to individual health needs and people belonging to vulnerable groups in other member states. Therefore, there is no to date, and the three of us came to the same conclusion while preparing our talk, there's no systematic data collection for the moment on the health of the newly arrived migrants and asylum seekers, or on their use of the healthcare system, and this is why we wanted to raise the awareness. So what are the future challenges? There's a striking need for more effective EU strategy policy for integration of migrants at the national and local level. As you can see, it varies from one country to another. Harmonization of healthcare across member states is important. What has been underlined by our analyzers of the data, and which relates to some of the hematological diseases I will refer to in my next slide, is that the population of the migrant is increasing. As I've said, 4% of the EU 28 countries' population is now of migrants and refugees. It is exceedingly younger population than our medium European population, 34 versus 45. It's also interesting to remind ourselves that the migrant health may be influenced by the new environment that they will find in Europe, and the fact that this challenge to the new environment may be different depending on their different susceptibility genes. So in hematology, what are we faced with? The most important is the abnormalities due to the genes of hemoglobin, which affects, of course, young children like sickle cell anemia, less frequent thalassemia, and also the young women who come and who will give birth to babies. This is due essentially to the country of origin of the majority of migrants, which are coming from Syria, and therefore these are at risk. There is no different guidelines for diagnosis of anemia, which have been set up and which will need to be set up for our everyday practice. There is an expected different cancer profile. They are healthier than we are. They have less cancers, and their cancers arrive later, but they may be at risk when they arrive in Europe to have a new cancer increase. They have absence of cancer prevention. There is no HPV prevention, for example, in young women. There's lacking hepatitis B prevention also. It may be expected for, let's say, anticoagulant, for example, as they mainly suffer from cardiovascular diseases, that gene polymorphism may change their response or increase or make us see different side effects depending on new gene polymorphism. And last comment is that, of course, they come with a challenge as we do not understand their language, and neither do they. And as you know, we've been taught to pay much attention to our communication or to our patients, and this is something that we will need to face. So just to summarize, at the end of the session yesterday, which I am happy to say was full, we stressed three major things. In most of the countries, and the discussion was essentially in Germany, which has an increase of health refugees, the difficulty for hemoglobinopathy is that the screening of these abnormal genes at neonatology is not systematic in Germany, whereas it is, for example, in France. And so therefore, the pediatricians stress that the country sets up this screening urgently as they have much more cases. The second topic is that we need to make our healthcare professionals more aware of these diseases. It's diseases we all know, we have all been trained to take care of, but we tend to forget them, and we have, unfortunately, put them in, let's say, reference centers, and the refugees are now widespread throughout the countries. For the infectious diseases, once again, we know them. They may come with multi-resistance antibiotics, and we need to be more aware of the different reasons why a patient may have fever. So we know how to treat them. We need to be aware and more trained, and we need to know how to communicate with these patients. Thank you.